I'm Dr. Demetrio J. Aguila III. I'm a peripheral nerve surgeon, I'm an ear, nose, and throat surgeon, and I'm also a plastic surgeon. I'm the host and founder of the Direct Care Movement podcast, where we dive into the intricacies of direct care, whether it's direct primary care or direct surgical care. You can find out more about what this movement is and where it's going and where it came from. And I am excited to have with me our guest today, Dr. Paige Day. She's a direct care vestibular therapist. Welcome, Dr. Day.
Thank you. Thank you for having me.
Tell us a little bit about yourself.
Well, as you said, I'm a physical therapist. I got my training just as any traditional physical therapist does, and then eventually went on to learn more about the vestibular system. That's where my passion lies, and then started a practice that's all vestibular focused.
That's awesome. So tell us a little bit more about your practice. How did you get started? How did you decide? What kind of format do you have?
Yeah. Well, I didn't really ever intend to start a practice, so I say it kind of happened to me. I was working PRN, outpatient, and acute care in a hospital setting, and I had a patient that needed my services, and I didn't have a clinic that I was routinely at to offer him a spot. So I thought, well, why don't I just start a side hustle? That was kind of a buzzword at the time. I was in some Facebook groups of different PTs that were kind of breaking out of the system. And I thought, well, okay, I can do this on the side. And then I did not want a large overhead. I was not going to take out a business loan. I did not know what it would turn into. And so I figured, well, I'll work my regular PRN hours. I'll see a few patients on the side. And so I started a mobile practice. So you could call it mobile PT or concierge PT. I bought a few things. I had a roller bag with my different pieces of equipment in it, and I would just go to people's houses. And then eventually that led into renting spaces. But that's how I started, and it was awesome. It was so fun and exciting, and things just grew from there.
Now, did you do anything with insurance when you first started out on your own?
I dabbled in Medicare very briefly, and that quickly was not my favorite thing to do.
Tell us why.
It was very time consuming. The application process was long. I didn't understand it. I didn't understand really much about insurance at all. I just kind of knew that it was not a place I really wanted to spend a lot of my time and attention, but I was told, oh, you have to take Medicare. And so I did, but mind you, I was driving to people's houses, right? So I was, maybe driving 30, 45 minutes away, spending an hour per session with patients, and then driving home or to other patients' houses, and then having to manually fill out the claims on my own time afterwards, only to not get paid for more than 6 months. And then the payment was pennies in comparison to the time that I spent.
For sure. So you started out, again, dabbling with Medicare, and you kind of gave up on that.
Yeah.
So how many employees did you have at this point?
Zero.
Just you.
Mm-hmm.
Just you. How many employees do you have today?
Zero. Yeah.
Just you. So you run a pretty lean practice, right? What does that do for your overhead?
It keeps it really low. It's very nice and less stress. I think the more parts and pieces and people there are to manage, the more problems you have. And so my problems remain minimal, and I really like that.
Sure. And then what does that do for your margin?
I make more.
Yeah. So if I hear you correctly, and tell me if I got this right, having a lean practice gives you the flexibility to see fewer patients, spend more time with each of those patients, and still bring home a pretty good paycheck. Did I get that right?
Yeah.
Okay.
Yeah. I can put it into perspective a little bit too.
Please.
So when I was full-time outpatient physical therapist, I was seeing sometimes 18 patients in a day. Now that is the maximum I will see in a week.
Wow.
That's 3 days a week.
And your take home is better than it was then.
Yeah.
So let me ask you this, okay? And obviously this is something you and I have discussed before offline. When you are treating a patient, whether it's in your current practice now or when you were working for the hospital, who takes on the risks associated with the care of that patient?
I do.
You do. Okay. You take on, would you say the majority of the risk?
Yeah.
Would you say the vast majority of the risk?
Almost all the risk.
Yeah, almost all the risk. In a hospital setting, who gets the majority of the reimbursement for that risk?
Yeah, they do.
Yeah. And then in an insurance-based setting, whether it's a hospital or a private practice, who gets the majority of the reimbursement?
Well, insurance will keep most of it, and then the hospital mostly.
Yeah.
And
how about now?
Trickles down to me.
You.
Me. Yeah.
Okay. So now one of the questions that I'm sure a lot of people are asking right now as they're listening to this is, well, wait a minute. Okay, so that's fine. Okay, so maybe we've convinced them that you don't have to see as many patients to take home as much or more pay, and you're being rewarded for the risk and the quality of reward, right? But how the heck do you get patients, right? I mean, when you were an employee, you didn't have to worry so much about that, right? I mean, the hospital got the patients for you. They would funnel the patients to you. You just showed up, punched the clock, and you got a paycheck, right?
Yeah.
What about now?
Yeah. That was a hard thing at first because I was working for a large company and I did not want to get into any sort of legal trouble if I were to mention something about my own practice to patients while I was working there. So I said nothing. And in turn, I felt like I couldn't talk about it. So then how was I going to get patients? So I posted in Facebook groups. I started having coffee networking dates with local providers that were also doing similar things. So for me, that was a lot of chiropractors, audiologists, nurse practitioners. Eventually I met you. So it just getting myself out there. And I think the exposure was a big piece of it. I even did, it was called the Beer and Bagel Run. It was a 5K. I set up a booth. I had a handful of people stop at the booth. I mean, it didn't get anyone in my door, but it got my name out there.
Sure.
I did a free community masterclass, if you will, at a local library for people to attend. So I was just doing anything that I could to get myself out there. I'm not from this area, so people don't know me off the bat. I don't have family here that just know a bunch of people and have friends. So I really had to kind of get out there myself.
Wow. So tell me if I heard you correctly. There's not an easy button for this, is there?
No, it's not easy. No. And you'll see some businesses that do feel like overnight successes, but most of us are not. And it does take a lot of passion and grind and faith that it will work out. I'm 4.5 years in and finally to the point where I'm at what I would say my max caseload, and it's been consistent now, which is great, but it hasn't been that way the whole time.
Sure. So for an outsider looking in at your practice, and I remember having this impression when you and I first met, I was like, wow, she's got it together. She's got it all figured out. And, as you mentioned earlier, I mean, some people look like overnight successes, right? But as you and I both know, that is exceedingly rare.
Yeah.
And there are way more people that look like overnight successes than there are that are overnight successes. So what would you say was the key to the success that you're experiencing today?
Honest care. Because your patients that do put their faith in you, if you do a good job with them, they're going to go spread the word. And I try to remember that, especially in the beginning, you're just planting these seeds and the seeds might not sprout for a year and a half. I had several people say, oh yeah, I wanted to come in last summer, but I put it off, or my kids had something going on or what have you. But those people eventually will call and they'll become your patients, and just do the absolute best job you can with them. Be honest. And that's what I am true to.
Sure. So when you were working for the hospital, how did patients decide to come see you?
They didn't.
They didn't. So it was decided for them?
They just got put on the schedule, and just luck of the draw, whoever had an opening at that time that they wanted to come.
Sure. And the insurance networks had something to do with that?
Sure.
Yeah. So they decided based on the network.
Mm-hmm.
How do they decide to come see you now? Based on what?
Word of mouth.
Mm-hmm.
Yeah. Experience in my office and then telling their friends.
Would it be fair to say they come to see you now based on quality?
Yeah. Mm-hmm.
Based on value, as opposed to based on just, okay, you're on this piece of paper or you're in this computer database that says I'm allowed to see you.
Yeah. And, when you're in the insurance model, you're checking the boxes. You have to do, at least in my world, you have to do an outcome measure because you have to justify to them that the therapy is medically necessary, even though we have our own judgment and can make that call. And then you have to bill certain codes based on what you did and be able to justify those codes. But in my office, I don't have to do that. If I want to spend the entire first hour just educating and talking to patients, I can do that and no one can tell me otherwise. And that sometimes can be so very valuable. It always is. Patients walk out sometimes feeling better just because I listened to them and not because I actually did anything.
Right. And so, I love that you point out the education piece because you have a doctoral degree in physical therapy, right?
Yes.
Doctor comes from the Latin word docere, meaning to teach. And so, isn't that really your first job, to educate your patients?
Yeah.
When you were in the hospital setting, how much of that education did you get to do compared to what you get to do today?
Hardly any. And if I did, then I was scrambling to come up with units to charge because you can't, how do you charge education? You just really, there's not a code for that.
Right. And so these days, patients choose to see you based on value. And they come back to see you because of what?
Good experience, and they feel better and they trust me.
Sure. And who, in the previous setting, you mentioned, you have to come up with justifications. You have to have medical necessity. Well, who were you justifying that to when you used to work in an insurance model?
To the insurance.
To the insurance company. Who determines medical necessity now?
I do.
You, along with
the patient.
Anybody else? Any third party to tell you what you can or cannot do?
No.
Any third party to tell the patient what the patient can or cannot do?
Nope.
No. This is why we call it direct care, right? It's direct just between you and the patient. So we were talking a little bit earlier before we started the recording. Obviously, we've just talked about some of the great benefits, right? Some of the awesome things about practicing direct care, the way it's always been practiced, right? For thousands of years all around the world. Tell us, if you're open to it, share with us some of the pitfalls.
I think we alluded to this already, but my biggest pitfall was getting patients in the door because it's hard. And then the inconsistency in income at first when you have a good week. And then for me, I don't see patients very long at all. It's maybe 6 sessions and then they're gone. And then I'm, okay, is my phone going to ring again? And then I'm trying to, in the early days, okay, well, I need to make a freebie online so I can get emails for email marketing, or I need to create online programs or downloadable PDFs that patients can buy. And I think I was trying to do too many things. And, kind of one foot in this and one foot in this, and then also still trying to juggle PRN. And so I think one of the pitfalls is that when it's slower, it's easy to be distracted and try to, what am I doing wrong? What else can I take on? What more can I be doing, when you can just trust the process and hone your craft and get really good at what you do.
Sure. So then if I hear you correctly, there are really 2 pieces. One is marketing, which we're going to talk about in a second. And the other is just being really good at what you do. Right?
Yeah.
I think most of us, we're accustomed to being good at what we do. That's what we were taught from the beginning of our training. You just got to be good at what you do. So I think that's something that a lot of people, they're comfortable doing. What about marketing? I remember when I was in training, I imagine you had a similar experience. Marketing is a dirty word. Marketing, you don't have to do marketing. You shouldn't have to do marketing. People who do marketing, there's something dirty about them. There's something sleazy.
You feel like a used car salesman.
Exactly. So, do you still feel like a used car salesman?
Not anymore.
No. Okay. So what changed? How did that change?
I stopped focusing on feeling the pressure to get patients in the door and just sharing with them what I could do for them. And then the ball is in their court. And if they want to come, they'll come.
Sure. So then you put the decision on their shoulders.
Mm-hmm. Yeah. And I stopped trying to take anyone and everyone and realizing that my perfect patient, if you will, my ideal patient will be the best fit for me and I'll be the best fit for them.
Sure.
And so if I'm not just trying to take everybody because I want patients in my door, is going to remain that honest care.
Sure. So now, I mean, you're a fully trained physical therapist. If somebody were to call you today or email you today or reach out to you today through one of your social media channels, and say, you know what, I'm going to be undergoing a total knee replacement and I need somebody to do my physical therapy afterwards, what would you say?
I would tell them that I'm not the best fit for them, and then I would guide them to a place that I think would be.
But didn't you feel at the beginning, I mean, I know I did, when I started paring things down, didn't you feel like, well, wait a minute, I've been trained in this. I know how to do this. I'm good at this. Why shouldn't I do it?
Yeah. Yeah, I did. And I did take cases on like that at the beginning, but anymore, I haven't done that in so long. I could still do it and do it well, but my passion lies in vestibular. And I know that there are physical therapists whose passion does lie in total knee replacement therapy. And so that person is going to be a better fit. But also, if I point them in the direction that will be best for them, they're still going to appreciate that. And then when they hear of someone that says, yeah, I've been having dizziness, they'll be like, oh, you need to go see Dr. Day. And it still looks good upon you to refer out to the right person.
Sure. I mean, that can be kind of intimidating, can't it? You say, well, I'm not an expert in everything anymore.
Yeah.
I mean, maybe at one point you felt like I can do all things physical therapy from top to bottom, right? And maybe you still can. But what kind of message does the patient get, or the prospective patient? What does the prospective patient see when they look at a website or they see a social media post that says, I'm good at everything?
Yeah.
What do they think?
I would think, what are you really good at? Do you really know as much about this as you should, or should I go to this specialist that's what they see all the time?
Sure. And so you've picked a niche,
Mm-hmm.
And maybe the niche picked you.
Yeah.
Tell us how you ended up there.
Yeah. Well, in school, we get a 2-hour lecture on the vestibular system, and we learn about posterior canal BPPV, a little bit about vestibular hypofunction. That's about it. And that may sound easy, but there are complexities to those couple of things. And I remember studying for our lab practicals, and it just made sense to me. Whereas my classmates, it did not. And so I ended up teaching them. And I thought, this is kind of cool. This just clicks for me. And then out of school, the very first continuing education course I took was a vestibular course, and I just loved it. I could not get enough. And then I had told our secretary at the hospital, the outpatient clinic, I said, anytime anyone calls in with any complaints of dizziness, put them on my schedule. And the other therapists in the clinic were totally fine with that, because most people hear dizzy and they don't want anything to do with it. So I took all those cases, and I just wanted to immerse myself as much as I could. I would go home and read research at night, and I signed up for every single course that I could, that I had the time to take. And I went all in, not knowing that it would lead to starting a business. I just wanted to know as much as I could about the system, because it's fun. It's never boring. There are some parts of PT that do get boring, and this does not. It's always exciting.
That's awesome. Now, when you first started out and you decided to commit full time to direct care, you decided, you know what, I'm not going to work for the hospital anymore. How did you feel at that point?
I was scared to make the decision, but when I walked out of those doors, I felt so light, just a weight off of my shoulders.
Sure. And then how did you start the full-time practice?
I opened more hours, and I didn't really realize that not having enough hours open in the week was hindering me. I knew that from the get-go, I set boundaries, because my goal in this practice was not to work 40 hours a week. I have 3 kids. I'm a wife. I have other duties that call me. And I did not want to just kind of replicate what I was leaving in my own office. So boundaries were first, and I really only wanted to work 3 days a week. But at that point in time, I was only open 2 days a week. And once I opened another day, people started booking on that day. And I thought, wow, okay. And it has slowly just filled and filled. And so now I'm even at the point wondering if I open a fourth day, what's going to happen? Is that day going to fill too? But again, I have to respect my boundaries too.
Sure, sure. And I'm glad you brought that up, because I think it's really easy for people who are entrepreneurs to say, well, you know what? There's 168 hours in a week. I mean, I only need to sleep one of them, right? And I'll just be open at midnight,
Yeah.
Tell us about the importance of those boundaries.
It's everything, because otherwise you'll burn out and you'll just run yourself into the ground. I know as an entrepreneur, even when I'm not in the office, I'm still always working. I'm still always thinking about it. I'm answering emails or DMs on Instagram, and those boundaries could be better.
Sure.
But it's easy to just always be working. And I think it's good to remember to set a good example for my family and my kids that are watching me all the time, that, you can do both things well, but you have to have boundaries to do that.
Sure, sure. So when you were thinking about leaving the hospital practice, one of the things that I know a lot of people talk about, because this is a conversation I have all the time when I'm talking to physicians about this, they love to tell people about all the bad things that they hate about working for the man, so to speak, until it's time to squeeze the trigger. And then they think, well, wait a minute. All I have to do is show up, punch a clock, and collect a paycheck.
Yeah.
What were the things that went through your mind that finally pushed you over that edge, that made you say, you know what? Yeah, there's some sense of security in continuing to work for the hospital, but what I have in mind is better. It's worth giving up that security.
Yeah. I had a unique situation in that I don't carry the benefits, and I did not receive benefits at that job. And I really only needed to work enough to make my student loan payment every month, which at that point in time was 6 days a week. And part of my obligation as PRN was working 2 weekend days in a month, which at the time was fine. But as we had kids, that got harder. I didn't want to be gone all weekend. And so those things, I know people will say, well, I get, I've worked here for so long, I've accrued all this PTO. I don't want to just leave that. That was not in the picture for me. But I just did not want to go to work, which was really sad for me because I really love being a PT, but I just did not want to go. I didn't enjoy it. It was just kind of slowly sucking my soul is how it felt. And so I knew it was time to go, and I probably should have left a year before I did. But I also did have a nudge. Creighton University reached out to me to help them with research. And it wasn't any research. If it was just some random, working with mice in a lab, I would have said no. But it was studying the vestibular system in human subjects and, doing novel test protocols that are hopefully going to translate into clinical practice. Because that is right up my alley, I said yes to that. And I still do that. But it very well fluctuates with hours as well. But that was the catalyst, I would say, to push me out of the PRN job, because I didn't want 3 things.
Sure.
And so it did take some nudging, because I don't know that I probably would have stayed even longer in that PRN, but I was definitely ready to go.
Sure. At any point after you got into practice on your own, were you scared?
I don't recall feeling that way. And I think, becoming an entrepreneur, I've really had to trust God tremendously, because starting a business is a leap of faith. And then right after I started my practice, I found out I was pregnant. And at that point, my practice was small. So I was able to take a maternity leave and close my doors for 12 weeks. Well, then when I got pregnant with my third kid, I was having more consistent patients in my door and I really didn't want to close my practice. And so on a whim, I just put up a post on Instagram and said, hey, I'm looking for a part-time PT to help me out. And it took like 4 or 5 days and someone reached out to me. And I thought that was not going to happen because not a lot of people know the vestibular system. And I knew that would be the case, but I was willing to train somebody. So someone reached out and I got her trained, and she was actually very busy during my maternity leave. And to me, that was just like God provides when you need him, because it could have been dead. I could have, not had any money to pay her or pay myself on leave. And so I've had to put a lot of faith in him and trust in him, and he's always provided. So I don't think that I ever really had that fear because I've seen enough along my journey to know that it'll be okay.
Sure. What would you do differently if you can go back to your old self the day before you were going to finally cut the cord? What advice would you give to your old self?
To trust more and leave my other position earlier, because it did take 4.5 years to get to the point where things are great now. But could that have happened in 2 years if I didn't have one foot in and one foot out?
Sure.
Because it's when your energy is divided, it's going to be slow like that.
For sure. So we touched on this a little earlier. Tell us about your marketing. What did you do starting out, and how has that evolved into what you're doing today?
Yeah. Well, Instagram is my primary source of marketing, and it's free. I did hire some coaches at the beginning, and great people, love them, but I don't think it was worth the investment that I paid. And then I also did hire a marketing gal for a time that posted on my Instagram page every day. And I don't know that was fruitful either. It's just when I show up real and raw and I'm making educational content that's relatable and I'm showing hints of my personal life, because I've learned that if it's all strictly education, sometimes people get bored with it. But if you kind of sprinkle in these little pieces about who you are as a human, they connect a little bit better. And then I had some reels that I guess you could say went semi-viral, and grew my following quite a bit. And so that's just kind of been the tried and true for me.
Sure. How did you decide on Instagram as your mainstay?
My age range and my patient population is primarily on Instagram. And I didn't necessarily know that at first. That's just where I was posting, and it automatically posted then to my Facebook.
Sure.
And that's just kind of where people were commenting and interacting with the post more. So I just continued to put my energy into that.
Sure. So it sounds like when you started to see some success on that particular platform, you doubled down and you said, okay, because it would have been easy to do what I did early on, which is to say, okay, we're successful on YouTube. We're not as successful on this other platform. So I'm going to invest more time and money into the platform where I'm not successful because YouTube's doing okay. Uh-huh. You did just the opposite.
Yeah.
Right? Tell us about that, and tell us, how did that work?
I think I just didn't have the capacity to take on more platforms. So I just continued with what was working well. And then it sparked creativity, and I created an online course and a coaching program for people that have dizziness all over the world that couldn't access the kind of care that they needed. And it just continued to, when you get these glimmers of success, it kind of keeps you going. And so it keeps you coming back.
Sure. So from what I hear of your description, it sounds like you're answering a different question than the question that a lot of people are inclined to ask. Because I get asked a lot, well, how do I sell myself? How do I sell my practice? It sounds like your question, or the question you're answering, isn't how do I sell? It sounds like it's a different question you're answering.
How do I teach?
How do I teach? Right? So tell us about that difference. Why did you choose that path? Educating versus selling, and how has that been working?
I already knew that I could answer their problem, but I knew that they needed to know that they had the problem. Mm-hmm. Vestibular is very much a niche. And for years, people have just dealt with their dizziness or been told that there's nothing they can do about it, when I know that there is something they can do about it. May not mean full resolution, but
Sure.
there are things that we can work on. And so I knew my number one problem was to just educate patients or prospective patients that if you have this issue, I can help you, but also providers. It's not just prospective patients that follow me. It's area providers. It's providers all over the country. And so it's good for them to know those things as well, because they might be seeing somebody that could use my help.
Sure. So to summarize, be the expert that people trust when they don't need you, so that you're the one they turn to when they do need you.
Yep.
Did I get that right?
Yeah.
Okay. So I can read between the lines a little bit.
Yes.
So, okay, before we tie up here, I want to shift gears a little bit, because some of our listeners are employers who are thinking about setting up direct contracts with people like you and me. But what they're accustomed to is going through insurance networks. For an employer, what's the advantage of reaching out to you if they have patients or if they have employees who are dizzy?
Cutting out that third party gets your employees care faster, and saves them money. They're not having to spend money on the insurance and then not recouping that. So faster care and more money in their wallets, essentially. And
Sure.
their employees will feel better cared for too.
Sure. And when you set up that direct contract, there's a set fee in advance. Like you know what you're going to charge.
Yeah.
And they know what they're going to pay, right? So there's none of that uncertainty, and you get paid pretty quickly in those scenarios.
Yeah. No surprise billing. You know what it's going to take up front. It helps you budget, helps you save.
And then multiply that by however many employees that employer has, and you can see the savings.
Yeah.
Okay. So as we're winding down, I'm going to ask you 3 questions.
Okay.
Okay. Question number 1. Do you have any regrets about anything that you've done in the process? Anything that you would look at and say, you know what? I shouldn't have done it that way. I should have done this instead.
I don't think so.
Okay.
I think every step that I've taken has led me here.
Sure.
And it's all been a learning process. I think if I could sit here and say, oh, I should have, maybe left my job right away and went all in. But if I would have gotten as busy as I wanted to be right off the bat, I would have drowned.
Sure.
I think the organic growth was at the pace that it needed to be for me to be successful and me to keep up with it and learn my own systems, because as you said, marketing is not our first language. So it's taken trial and error. So I really don't think so. I think it's all put me where I am now.
Awesome. Second question. What is the single biggest objection that you get from people who are thinking about going into direct care, and how do you address that objection?
I think there's this fear of success. Will I be successful? It depends on how you measure that. Success in your own practice is going to look different than success in someone else's practice when you were working for a company. And, you can set your boundaries like I did to only work 3 days a week. And then it's not too hard to be successful because you can fill those days. So I think fear kind of stops people.
Sure.
But I say, imperfect action is always the advice that I give people.
Sure.
They want to have all of their systems lined up first and their website perfect. And I didn't even have a website. I mean, if you wait till everything's perfect, you'll never start. So I just do it.
Sure. That's awesome. Last question. Most important question. How do people find you?
Instagram is primarily the one. It's at the Dizzy Doctor with doctor abbreviated DR. My website is the-dizzydoctor.com, doctor spelled out in that one. So yeah, online is the primary. You can even just Google the Dizzy Doctor Omaha or Dizzy Doctor Omaha, and I should come up.
That's awesome. Any other last words of wisdom or advice that you have for anybody that's listening?
Yeah, it's, when we go through school, whether it's PT or medical school, we kind of get funneled into this box. You got to think within these protocols, and it's okay to think outside the box. It's okay to want to pave your own path. And that's another thing is a lot of us are very ambitious from a young age, and we know I have to do this and then do that and then follow all these steps and I'll get where I need to go. It's okay to pave your own path. And sometimes that's a lot better and much more rewarding.
That's awesome. Thank you. Thank you for joining us on the Direct Care Movement podcast. We're excited that you joined us, and we're looking forward to having you join us in future episodes as we dive into more questions and more concerns and more solutions in the direct care space, whether it's direct primary care or direct specialty care. If you liked what you heard and you want to know more, please click like and subscribe and leave us a review. And don't be afraid to reach out to us directly so we can get you more information about direct care, whether it's direct primary care or direct specialty care.